welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are the latest reports from the world of medicine. Prolonged TV watching linked with potentially fatal blood clots. Exercise and heart health go hand in hand, and it is a well-established fact that physical activity has an inverse relationship with atherosclerotic cardiovascular disease. Conversely, physical inactivity or prolonged sedentary behavior is consistently associated with an increased risk of vascular diseases, including atherosclerotic cardiovascular disease. Though the evidence on this account has mostly been inconsistent, a new study being published in the European Journal of Preventive Cardiology has highlighted that prolonged TV watching is linked with potentially fatal blood clots. The warning comes as the study reports that watching TV for 4 hours a day or more is associated with a 35% higher risk of blood clots compared with less than 2.5 hours. Therefore, it is advisable to take breaks when binge watching TV to avoid blood clots. Breastfeeding tied to lower risk of non-alcoholic fatty liver disease in women. The multiple effects of breastfeeding on maternal health outcomes have been demonstrated in various previous studies. However, there is not much clarity on the effect of breastfeeding on non-alcoholic fatty liver disease in women. A study in the journal Hepatology suggests the protective effect of breastfeeding against non-alcoholic fatty liver disease in the later life of women. It is said that breastfeeding showed a protective effect against this condition in the later life, suggesting that a maternal benefit of breastfeeding on non-alcoholic fatty liver disease. The risk was further reduced by increasing the breastfeeding duration. Prescribe aspirin based on benefit to risk, not age, urge the researchers. There has been considerable confusion from recently reported results of aspirin. As a result, the healthcare providers are understandably very confused about whether or not to prescribe aspirin for the primary prevention of heart attacks or strokes, and if so, to whom. Recent guidelines have restricted aspirin use in the primary prevention of cardiovascular diseases to patients under 70 and more recent guidance to patients even under 60. Yet the risks of heart attacks and strokes, we all know that increases markedly with age. The authors urge that to do so more good for the patients in primary prevention of heart attacks and strokes, healthcare providers should make individual clinical judgments about prescribing aspirin on a case-by-case basis and based on benefit to risk, not age. Boredom tied with setting off sadistic behavior. Sadistic behavior that is harming others for pleasure is well documented. We all know what it is. The past empirical research is nearly silent regarding the psychological factors behind it. Feeling bored can be a factor in setting off the sadistic behavior in a finding conducted by a team of researchers. This has been published in the Journal of Personality and Social Psychology. The researchers demonstrated that sadistic tendencies are more pronounced among people who report chronic proneness to boredom in everyday life. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.